Dr. Langford's work focuses on patient care and research in vasculitic diseases, including GPA, giant cell arteritis, Takayasu's, polyarteritis nodosa, PAN, MPA, EGPA, Church-Strauss, and other forms of vasculitis. She's a member of the VCRC steering committee and is active as a principal investigator on many clinical trials. And I know a lot of people, this is your first symposium, but she has been with the vasculitis community for a long time, and we owe her a big debt of gratitude. Please welcome Dr. Langford.
Well, thank you for that wonderful introduction and for having me here at this meeting. And Vasculitis Foundation does such a wonderful job with putting these symposium together and for the care and support of people with vasculitis in general. So it's truly a privilege to be here with all of you today. Let me just pull up here. There we go. All right. So again, I titled my talk Taking Charge and talking about monitoring and prevention. Because again, I thought this was a very important aspect of care in people with vasculitis. When we see people with vasculitis, we appreciate that there are a lot of aspects of the illness that can be a source of frustration. And if we think about how do we sort of put those as far as a final common pathway, one of the things that people often express is what they feel frustrated by as far as having a loss of that control. Wanting to be in control is a part of our basic human instincts in the way we are, and I think that there is nothing where that we feel that more deeply than in terms of our personal health. And when we think about this in terms of vasculitis, there are many aspects we know that are not under our control. Why did this disease happen in the first place? For those who have had a relapse, why did that occur? Those are things that we don't have control of. But the good news is that there are many aspects that we can positively impact. And it was so heartening to see on your description about this meeting that feeling empowered was something that you were taking away. And I hope that that is, because it's a very important part of your health care and your overall mission in the vasculitis journey. And two of those things that can be empowering are the aspects of monitoring and preventive strategies. So why are these important? Well, monitoring can provide us with information with regards to whether someone is in remission. It can help us to detect signals or signs of a relapse, hopefully at an early point. It can allow us to know if there are medication side effects that may be occurring, and can also detect other medical problems that can be just inherent in human life. Along similar lines, preventive strategies can allow us to reduce risk of medication side effects and also reduce our risk of other health problems. And again, the bottom line is it allows all of us to be proactive in protecting your health. So let's start with monitoring. What is monitoring? Well, is that when you get your blood tests? And the answer is yes, absolutely. But there are other aspects of monitoring that go well beyond blood tests. When we think about monitoring and trying to assess how is someone doing with vasculitis, there are multiple pieces of the puzzle that we put together. Very importantly, as we listen to all of your symptoms, what are you experiencing, and is that suggestive of something that's concerning for vasculitis or maybe something else? When you see the doctor, again, they listen to your lungs, that they look as far as and see whether there are features that might suggest vasculitis going on for mere examination. Lab results, so this is where, again, blood tests and urine tests come into place. And then in certain instances, imaging tests such as x-rays, CAT scans, or MRIs may play an important role. And it's really putting all of those together that we can get information as far as is someone in remission, are they having a relapse, and are there concerning features that may suggest a side effect from a medication. So all of these different categories are important in monitoring. What is done in each of these are going to be influenced by the type of vasculitis a person has, the organ site that is affected, what medications are being given, that person's current activity disease setting, so it may be very different as far as how we might monitor someone who is newly diagnosed or just had a relapse as compared to someone who had been in remission for a period of time. And then the presence of concurrent illnesses, say such as diabetes or high blood pressure or maybe other things may influence our monitoring strategies. So as we can see, the monitoring plan will be slightly different for each individual. However, there are some general concepts that we do have in monitoring, and we can look at, say, 2 different examples. So in our small vessel vasculitides, such as GPA or MPA, again, the symptoms we might be looking for would be things related to the ear, nose, and throat, shortness of breath, neurologic symptoms, and certainly fevers could be related to the illness or to an infection. On examination, we look for clues from the organ sites that may be affected, again, such as the nose, the eyes, the heart and lungs, the nerves, the joints, and the skin. In terms of our lab tests, our most basic labs are in many ways our most important in terms of blood counts, looking at measurements of liver and kidney function, and inflammation tests, which can be our sedimentation rate and C-reactive protein, and then the urinalysis, which I often say is one of the most important and most potentially underappreciated tests in being able to detect kidney involvement. And then there may be instances where imaging is important, particularly if we're looking for lung problems, as we know that some people may have no symptoms and yet have something that we may find on an X-ray or a CAT scan. Again, people often ask, how often do I do labs? And again, this will be determined by your individual doctor. But if I have someone on Cytoxan, I will usually do these every 1 to no more than 2 weeks, otherwise every month. People may ask, well, I don't have ANCA on that list. And again, there are differing opinions about these by different doctors. So this will be a discussion that you'll have with your individual physician about their preference in monitoring ANCA. Now, if we shift then to the example as far as someone who may have a large vessel vasculitis, again, the symptoms we may look for could be things like headaches, eyesight changes, pain in the jaw with extended chewing, pain in the arms and legs, chest pain or dizziness, or again, fever, which would be, again, something we look for in all forms of vasculitis. The examination may be slightly different here, so we're looking at the arteries along the side of the head, the temporal arteries. We look for pulses in the arms and legs, blood pressures, heart sounds, and we look at the joints. There are similarities in terms of our lab tests, in terms of blood counts, chemistries, and markers of inflammation. And in large vessel vasculitis, particularly Takayasu arteritis, imaging plays a particularly important role in looking for new narrowings or widenings. So we can see that there are some differences as far as depending upon the different illnesses as far as how we might monitor the illness. And again, in terms of labs, my personal practice is I typically will do these about every month. There's also specialized monitoring or consultations that we may have from individual specialists. So examples might be from an ear, nose, and throat doctor like Dr. Lebovics you saw yesterday. May be very important in an illness like GPA. Ophthalmology plays a very important role in illnesses such as giant cell arteritis, Behçet's disease, and certainly our small vessel vasculitides as well. And for someone, say, who has hepatitis C-associated cryoglobulinemic vasculitis, involvement with a liver specialist or hepatologist may be important. And there may be specific testing that we may do. A test called a urine cytology. We would look at the health of the bladder cells in someone who has received Cytoxan in the past. Pulmonary function tests or lung function tests in EGPA, and also an ultrasound of the heart or echocardiogram in EGPA. And hearing tests or audiograms can be important in people who have hearing instances in many forms of vasculitis, particularly GPA. Now, for people who have a form of vasculitis that can affect the kidney, one of the forms of monitoring that we often teach people to do in their own home is what's called self-urine dipstick testing. And this is because microscopic blood may be one of the first indicators that we see of active kidney disease, and this is not something that we can see. In most instances, when the kidney is inflamed, the urine itself still looks yellow. We don't tend to see it looking pink or red, but there may be microscopic blood that's present in the urine. And this can be self-monitored using these sticks between regular labs. And what you can see in the picture here is that these are little plastic strips. They have little colored squares on them. We dipped it in the urine and then compare it with the side of the canister, which is what is seen here on the slide. Now, there are limitations in doing this. This is not useful in people who already have blood in their urine. Potentially, if they've had injury or damage to their kidney, they may have blood that persists. And it's not specific for active kidney disease, so you can see blood in the urine for other reasons. So kidney stones and urine infection, gynecologic causes, these can all be reasons why we can see blood in our urine. So establishing a plan for monitoring is important, and you should talk to your doctor about a monitoring plan that is specific for you. You should ask what symptoms to watch out for and what should you do if they happen. How often should you come in for your physician visits? How often should you have lab tests and what type of tests should you have done? And if there is imaging that you should have performed, what type and how often? Also, again, if there's a need to have specialized monitoring to work with other doctors. And then keep in mind that the plan that you have for monitoring may change over time. So what you do today may be different than what you do for a year from now, so that may change. Now, in shifting to preventive strategies, these can really be viewed in different ways. They may minimize or prevent certain medication side effects or keep you in the best possible health. And you've heard some about this during the course of this symposium. Now, every medication, no matter what it is going to have its own side effect profile. And while these side effects often will not happen, knowing about them and having this awareness is important, because doing that, we can have strategies that can help to minimize, prevent them, or detect them early. Probably far and away one of the most important things is knowing what medicines are you taking and the dosage. This could be something that you can keep in your purse or wallet, or nowadays electronically there are resources, because we know that sometimes this can be complicated and it can change over time. You want to try and understand as much as you can about your medication, and sources include talking to your doctor, talking to your pharmacist, and if you don't have written information on the medication, ask for it. Again, we have to be a little cautious as far as information on the internet, and again, if you want more information, certainly your doctor and pharmacist can provide you with resources that can be reliable about your medications. Know how to take the medication. Is there a specific time of day? Should it be taken with or without food? Recognize that there are symptoms of side effects that you should watch out for. If there are certain medications you should not take together. And to work with your doctor in applying these strategies to lessen side effects. So we're going to look at just 4 examples. Again, the good news is there are so many different medications that are used in vasculitis now. Unfortunately, we won't be able to cover all of these. And again, some of the side effects I'm just going to briefly highlight are not consistent with all of the side effects that we can see. So one of our older medications, cyclophosphamide or Cytoxan, again, we have an appreciation of infections, lowering of blood counts, bladder side effects, and risk as far as effects on fertility in both men and women. But again, there are preventive strategies in terms of having labs frequently. We try and limit the time that we use Cytoxan to only what is needed. And again, this often is about 3 to no more than 6 months. Using birth control to prevent having a child during that period that you're on Cytoxan. And there are strategies to lessen fertility concerns. When someone is taking Cytoxan by mouth every day, taking it all at once in the morning with a lot of fluid so it's flushed through your system is very important. And there's a medication that we can use called Mesna to protect the bladder when it's given by vein. Methotrexate, another commonly used medication where again we have concerns for infection, lowering of blood counts, liver side effects, and it can cause a lung irritation as well. Once again, we have preventive strategies in terms of having labs done to follow the blood counts and liver tests. Again, generally it's advised to avoid alcohol-containing beverages because those do affect the liver as well. You should let your doctor know about any cough or shortness of breath. And there is a vitamin called folic or folinic acid that can reduce some of the side effects. And some of these can also be reduced in certain settings by taking methotrexate as an injection just under the skin. Azathioprine or Imuran, another commonly used medication that can be associated with infection, lowering of the blood counts, liver side effects, rare allergic type reactions, and it can be, again, not broken down by people who have a certain enzyme, and there is an interaction with certain medications that are used for gout. So again, having labs done can be used to detect a number of these. There is a screening blood test that some doctors will do called TPMT before Imuran is started. You should let your doctor know, of course, of any fevers, rashes, or other concerns, and let your doctor know about any new medications. And then, of course, prednisone, which is fairly uniform in almost all forms of vasculitis. Wide list of concerns, but again, some of the things that we can take a very proactive approach with in terms of infection, bone loss, blood sugar, blood pressure, our eye health, and sleep disturbance. Blood sugar is commonly tested in most of our chemistry panels, so your doctor should be monitoring for this along the way. Bone protection is very important with prednisone use. So there is a simple test called a bone density, which looks at our most at-risk areas as far as the hip and the spine, and can allow us to assess the bone density measurement. Vitamin D deficiency or lowering, very common in the United States, particularly in states that tend to see harsher winters. This can be checked by a simple blood test and kept within a normal range. And there are an increasing number of medications that can be used to prevent bone loss and actually increase bone density. Blood pressure checks, eye checks, and again, there are sleep strategies that can all be used to try and combat some of the side effects of prednisone. So all of these, as we saw, had this common link of potentially risk of infection. And again, you've heard that there is great importance as far as frequent hand washing, our friend the hand sanitizer, as far as, again, really watching your health as far as hand hygiene. Again, in people that you feel comfortable sharing about your illness, as far as if they are, have a cold or some other infection concern, to ask them to visit at a time when they're feeling better. And of course, to report any new infection symptoms to your doctor right away. One particular type of infection is a lung infection called pneumocystis. And this is, can occur particularly in people who are on prednisone plus another medication. And this does include rituximab, which is used in GPA and MPA. But there are medications that can be used to prevent this. And those include Bactrim or trimethoprim sulfa. For people who can't take that, there are other choices as well, including Dapsone, atovaquone, or Mepron, or pentamidine. And we do think this is a very important preventive strategies. Another one is the use of vaccinations or immunizations. So long-lived vaccines are important and beneficial, and probably one of the most important and common ones that we should get as far as our annual flu or influenza vaccine. There are also 2 vaccines against a very common type of pneumonia that occurs in our communities called pneumococcus. And we've seen some of these again on the television. They're called the Prevnar and the Pneumovax. For people who are younger, there are vaccines against HPV, which can be a cause of cervical cancer, and also meningitis that can be received. Now, one category which does generally need to be avoided are what we call live vaccinations. So it actually contains the actual live virus, and the most common one is a preventive against shingles or zoster. There are instances where certain doses of immune suppression medicine this can be given, but in many instances in vasculitis that may not be. So talk to your doctor as far as before you would receive that particular vaccination for shingles. Now, what about other preventive strategies for our general health? And there are a number of these that are important in vasculitis. Heart and vascular health, so being aware as far as what is our cholesterol measurement, other risk factors for heart and vascular disease. We talked already about bone health. Skin cancer is a very common thing just in human life in general, and particularly in those of us who have had exposure in sunnier states. So often, again, having an annual skin check can be very helpful. And again, eye checks from our ophthalmologist. Another thing that is very important, that we don't forget our routine health care that's important for everyone. And again, it's understandable sometimes as far as, well, you've got a lot of things going on already, worried about this. about doing these other things. But they are important because, again, these are things that affects us very commonly as people. So a colonoscopy, as far as appropriate to your age and your family history, if you've had someone in your family that's had colon cancer. For women, mammography and general gynecologic care, and for men, their prostate health. Use sunscreen. Again, a very simple thing, but very important as a preventive strategy for skin cancers. Even if you don't think you're going to be out very long, or even if it's actually a cloudy day, we can still be exposed to UV rays that can cause burn and place us at risk of skin cancers. And then our dental care as well, because that can be a source of infections. Smoking, again, I think we all know the health hazards of smoking, but this is particularly of concern in people with vasculitis because it constricts blood vessels, it will increase blood pressure, it decreases oxygen getting to our tissues, it damages the lungs and mouth, and it will increase the risk of cancer. So stopping smoking or eliminating smoke from your environment is one of the most positive things that you can do. And we know that it's difficult, but there are steps that doctors can help to help you take this next step, or someone, one of your loved ones, if you're in that environment. And then diet. You've heard from this conference from a nutritionist, and again, one of the common questions that's often raised is whether there are specific foods to reduce relapses. And not that we know of as far as at this time, but this remains an open question that we all have a great interest in. Attention to diet is important, and the general concepts that we try and look for as far as is for a healthy, balanced diet where we watch our concentrated sweet intake. I always tell people to avoid extremes, so if there's a diet that says you're going to take an awful lot of this and not very much of that, that's always a little bit of a warning sign to me. And you do want to avoid having those fluids being made up of things that have high sugar or high caffeine. And again, there's a lot of things, again, pop with a lot of sugar, even our fruit juices that have a high sugar content. And any drinks that have the word energy in them, that's a little bit of a red flag as well. There are specific dietary requirements in certain settings. As far as people with kidney problems, there may be restrictions in terms of protein, potassium, and sometimes fluid. For people who have blood sugar problems or diabetes, sugar and carbohydrate intake. And again, a nutritionist can provide often very useful counseling in terms of dietary measures. Now, one of the things, again, it's another common question, is what is the role of stress in relapse and in health in general? And again, there's a lot of unknowns surrounding this and a lot of mixed data. But I think, it's fair to say that stress is generally not good for us as people, and wherever we can minimize stress is important. Now, that said, it's easier said than done. Stress can come about for many causes, which illness is going to intensify. And while it's not possible for us to eliminate stress, there are many times that it could be reduced. But how we cope with this and the strategies we use are going to be very person-specific. So while for one individual it may be very important and helpful to cut back or stop work, for another individual that may be the exact opposite that you want to do. So there's no one rule fits all. And our stress reduction strategy should be individualized. Now, one way that stress can be reduced is by exercise, but that's not always so easy. And again, sometimes there are things that just get in the way of that. And in vasculitis, we know that there are challenges. There are physical limitations that may limit exercise, that feeling of fatigue, having time and trying to fit with everything else going on in your life. And then there's sometimes people just say, I just don't like it very much. But there are some general concepts to work with all of those. One thing is that water exercise places less stress on the joints. It's important to start slowly and not overdo, because again, that's where people can get discouraged. If you pull something, you just don't feel very good about it. You want to start slowly and work up. Recognize that exercise comes in many different forms, and identify what it is that you like to do. I mean, if you know you don't like to do a certain type, avoid that and think about what are the types of physical activity or other sort of stretching that I can do that is appealing to me that I can start to work on. So before starting an exercise program, talk to your doctor though about what types of exercise you could safely do. Are there types you should avoid? Are there types, again, that you enjoy? And whether you would benefit from exercise instruction. So there are a variety of physical therapists, cardiac and pulmonary rehabilitationists that can actually help in structuring an exercise program that may be fit for your particular physical and health well-being. So in terms of preventive strategies, again, we all want to be proactive in being engaged about understanding about your illness. And of course, that's why all of you are here for this wonderful symposium and trying to understand more and see what sort of things that you can do together with all of us in trying to improve your health. Again, know your medications and doses. People often find it's helpful to keep a brief written history of your illness. This could be an office note from your doctor or a personal log, just in case you need to see a doctor who does not know you or if you're traveling. See your doctor regularly. Have your monitoring tests performed as is recommended by your doctor. Certainly let your doctor know about any new medications you were given, or even if you're deciding you're going to take a new over-the-counter or supplement to see if that would help, just to make sure it's not going to interact with your medications. Call your doctor about things that are new or that you're concerned about. And again, don't feel free to ask questions. And again, that's why you're all here, is to learn more. And again, take that spirit home as far as asking your doctor and other people as far as what information that you can find to really help all of you be proactive in this journey. So thank you very much, and I'd be happy to answer any questions.
You mentioned a lot of tests that should be taken for the different diseases and so on and so forth. From point A to point B, how long does it take to get those tests? In other words, sometimes you go to a doctor and you say, I think I have GPA, and that doctor doesn't have any idea what you're talking about. And then you have to find another doctor, and then you have to find another doctor and another doctor. How is that working into this situation?
So there's a couple different aspects. And the question is about, timing of blood, well, not blood tests, but testing in general, and particularly again during the initial diagnostic period, as far as if there's, some features going on where you have to go from doctor to doctor. Now, in terms of the first part, as far as timing with different testing, now some of those things will vary a great deal. As far as certain blood tests, we're going to have back in a day or two. Others may take longer as far as by the time they're done. And similarly, in terms of x-ray tests, scheduling them and getting the result will be variable depending upon, again, the situation where they're being done. Again, it's going to be different if you're in the hospital versus if you're in the clinic. We certainly recognize that the process of early diagnosis can sometimes be frustrating for people, as far as, again, having to go to different doctors who may have different expertise and trying to put together, as far as if someone is having different sort of symptoms in different organs, as far as how to be able to put that together. And again, the timing will vary a lot depending upon what the nature of the symptoms are. Some of them, there's going to be an immediate red flag as far as where people know what's going on, and the urgency as far as with that, while others, it can be a bit trickier. So I'm afraid it's difficult to put an exact timing on. I think it's fair to say that all of us, share the concern and urgency as far as being able to try and evaluate things as quickly as possible, either when someone is in the diagnostic process or after they've been diagnosed if they've got a new symptom, as far as trying to get those answers as soon as possible.
You talked about stress being a possible cause of relapse. Has there been any study as to whether stress could be an initial trigger for the disease?
Yeah. So again, I think stress is an area that people have a lot of interest in. I'd say it's one of the more common areas of discussion. And we have mixed information with this, as far as that there are people who either at the time of their diagnosis or at the time of a relapse have gone through a tremendously stressful event, and there's a question that certainly understandably gets raised as far as was that a trigger? Now, we've also seen the converse, as far as where people have gone through a tremendous life stress of whatever cause, and fortunately, their illness is not coming into the picture at that time. So this one infection that I referred to, again, the question is about antibiotics for prolonged periods. The one infection I referred to is a lung infection called pneumocystis, where we tend to use a low dose of an antibiotic as a preventive strategy. This is not a treatment-based dose, and again, the most common one we use is called trimethoprim sulfa or Bactrim or clotrimazole. So at the dose that we use, it would not be sufficient to be able to treat an active infection, but it is something that, again, can be used as far as preventively. Now, it often has come up as far as, well, is it bad to be able to take this, as far as aren't we going to be able to increase risk as far as organisms or infections getting more used to that antibiotic being around. In that particular instance, I would not say that that's a concern. The benefits outweigh the risks as far as doing that. Now, in general, as far as the idea, as far as just taking a full dose of an antibiotic on a regular basis, no, I don't think that's a good idea. As far as generally, again, we're going to use an antibiotic to treat an infection if it's present according to what studies have shown that we need to do, and then withdraw it, so we're not increasing the risk as far as with that. But again, in that one preventive instance, as far as for this pneumocystis, a low dose is again something that can be beneficial to do. Yes?
How common is that?
So the question is, how common is this pneumocystis? And fortunately, again, because of all the word that we've got out as far as with doctors, it's not common. If we were not doing this preventive strategy, we've seen the risk of people, again, on prednisone plus something else can be up to 10%. And again, it's a bad pneumonia when it happens, but again, in the setting of effective prevention strategies, we can reduce the risk to almost zero. One more question?
I understand prophylactic antibiotics, my involvement in GPA, but my doctor doesn't come along. But in addition to that, I think probiotics, is that advisable, not advisable?
Yeah, so the question is probiotics, and again, there are different formulations of this. Again, the most natural we have is yogurt. In a sense, which is a natural probiotic, and I don't think anyone would really have concerns with yogurt. Any of them will have, as far as, again, it's just the action as far as that you have, healthy organisms that are in there. There are other things that are packaged as far as in capsules and tablets. Again, most of them generally are fairly well tolerated. I would just say to talk with your doctor just so you can let them know which formulation you're taking. Sometimes there are some that will put some supplements in as well, and those can have different interactions with medications. So I just say let your doctor know as far as, again, with that.